Hello, everybody.
Say that. Hello.
Hello, everyone. Thank you for joining today's roundtable discussion on cannabis and mental health, hosted by the Coalition for Cannabis Policy, Education, and Regulation. My name is Andrew Friedman, and I serve as the Executive Director of CPEAR. The coalition is comprised of members that represent regulated industry, academics, think tanks, public policy officials, public safety officials, medical and mental health professionals, financial services firms, and social equity organizations, all of whom want to work to develop a policy and build a national conversation on federal regulation of cannabis. Put simply, cannabis reform is here. CPEAR exists to get it right. Today, over 40% of Americans have access to regulated adult use cannabis. And although state cannabis legalization is already underway, a federal framework to regulate and understand the effects of cannabis is absent. This week, we are publishing our latest policy paper entitled Prioritizing Mental Health in an Emerging Market, a framework for maintaining public health and expanding knowledge on cannabis and mental health. The study examines the current understanding of cannabis and its effects on mental health and recommendations to advance an evidence-based regulatory system. The regulatory structure governing cannabis use must be rooted in science, evidence, and data to inform a responsible marketplace and utilize reasonable guardrails. Our understanding of the potential harms of use as well as therapeutic applications of cannabis will continue to evolve over time through continued and advanced research. The need for cannabis to gain a more in-depth understanding about the mental health aspects of cannabis is crucial. Federal funding for research should be rooted in science and focused on these two issue areas: defining responsible use and improving screening tools for cannabis use disorder. On a personal note, this paper hits very close to home. When I first came into cannabis, I was the cannabis czar for Colorado for the rollout of Colorado's regulatory system. Within a few weeks of rollout, we had an unfortunate incident where a young man named Levi Tamba took too many cannabis edibles and had what I probably unscientifically and unmedically will call an acute psychotic break, and ended up jumping off of a roof at a hotel. And it was the first reminder that while we were here to regulate, we were doing so with the kind of two arms tied behind our backs because we had not done the science to understand what all the potential effects would be. But it was also an understanding that that this also happens in the illicit system, and the regulated system needed to do better. And we pretty immediately instituted a new set of edible regulations, which immediately led to better outcomes. And really, I think the promise of regulation is the promise that not that everything is harmless, but where there is harm, we can do a better job of leading with science and data in order to address those harms and move forward. So I really both appreciate this paper and appreciate the participants here today. I'm pleased to introduce our panel. First is the esteemed Representative Dave Joyce. It's an honor to welcome you today to today's panel. Our Congressman Dave Joyce is of Ohio's 14th District. Representative Joyce was elected to Congress in 2012 and serves on the influential House Appropriations Committee and is the Vice Chair of the Addiction Treatment and Recovery Caucus. Representative Joyce is also co-chair of the Bipartisan Congressional Cannabis Caucus, and just this month introduced the Harnessing Opportunities by Pursuing Expungement or HOPE Act. Congressman, it's great to have you, and we're excited to hear from you. And honestly, you are one of the great leaders in this area, and giving us your time and your wisdom is a great gift. So thank you for being here.
Very kind.
Next, we have Dr. Stacy Gruber, who co-authored today's policy paper. Dr. Gruber is the director of the Cognitive and Clinical Neuroimaging Core at McLean's Hospital's Brain Imaging Center and an associate professor of psychiatry at Harvard Medical School. Her clinical research focuses on the application of neurocognitive models and brain imaging to better characterize risk factors for substance abuse and psychiatric conditions. She has been studying the impact of cannabis on the brain for over 2 decades using neurocognitive, clinical, and diagnostic assessments and multimodal brain imaging techniques. Her work examining the etiologic basis of neural models of dysfunction in cannabis using adolescent and adults has been published in numerous peer-reviewed journals and has been the basis of national and international symposia, documentaries, and news stories. Dr. Gruber, thank you for your important work on this paper, and I'm grateful to have you as a friend and to join us today.
Thank you. Pleasure to be here.
Dr. Burnett. Finally, I'm pleased to introduce Dr. Malik Burnett, who has also wrote portions of our paper on mental health. As a physician, entrepreneur, and drug policy expert, Dr. Burnett works to advance the broader drug policy reform agenda with the goal of shifting US drug policy from a framework based on criminal justice to one based on public health. He's currently an adjunct assistant professor in addiction medicine at the University of Maryland Midtown campus, where he serves as the chair of the opioid task force, an addiction medicine physician at MedMark treatment centers, and a consultant for the Maryland Addiction Consultation Service. He serves on the American Society of Addiction Medicine, public policy and legislative advocacy committees, and is involved in developing a number of venture startups and drug policy initiatives through his consulting company, Provision Strategies and Analytics. Dr. Burnett, as always, again, it's a pleasure to have you, and thank you for your contributions to this world and to this paper.
Thanks for having me.
And with that, that's the most you're going to hear from me, I promise. We are going to turn first to Congressman Joyce. Thank you again for being here, and thank you for your work advancing the conversation around cannabis on Capitol Hill. Can you expand on your bill, the HOPE Act, and what you think and why you think it's so important at this juncture, particularly as it pertains to mental health?
Well, thank you very much for the opportunity to be here, and appreciate the opportunity to talk about the HOPE Act. As far as I saw the HOPE Act, we seek to remedy the war on cannabis where it's most pervasive. Just to give you an idea, in 2019, there were 500,000 cannabis offenses charged in the United States. Nearly 99.9% of those were non-federal. And from my time as a local county prosecutor for 25 years, I know that the records in those different counties in the state were only as good as the input they were getting. You know, the smaller the county, more things to do, they wouldn't bother to put those records in. And so it was hard for people to be able to overturn these charges or get them expunged. So if you look at when Illinois legalized cannabis in 2019, they included an automatic expungement provision for low-level nonviolent cannabis offenders, but the officials implementing these provisions recognized that the paper-based system that existed for criminal conviction record keeping presented an enormous burden. So the state worked with the private sector to digitalize and better automate. So funding is always an issue, correct? But it's important that we get the funding to those folks so that they could cure this problem and be able to get people expunged. Why is that important? Well, cannabis is an effective form of treatment for mental and physical health, but its criminalization over the years has the opposite effect. Low-level cannabis charges are stigmatizing. They block opportunities for stable housing and for employment. It further exacerbates the mental health crisis because people aren't allowed to develop that sound basis on which to have a start and get involved back and get their lives back on straight. So the HOPE Act is progressive in its scope and conservative in its approach. And I think it's a bipartisan sweet spot where both parties and chambers should get on board.
Thank you for that. It really is amazing work and a really truly novel approach to the same question that has been coming up. And again, speaking of Congress, Congressman Joyce, how has the political narrative and the Republican Party evolved on cannabis since you started working on this issue?
Well, slowly. You know, when I first time I voted on, there was a nice argument being made by then Congressman Farr about the VA Milcon bill. And talking about how in California, where it's medically legal, VA doctors could not prescribe it to people. And the veterans who were using it for PTSD and they were finding a calming effect or things that were good for them, I thought that was a good idea. So I voted with him, only Republican. And next thing I got summoned to the Speaker's office, Speaker Boehner, who asked me, what the hell was I thinking? And I explained to him that what I was thinking, A, and two, that I still believe it's a states' rights issue. And who are we to deny people who are suffering from PTSD, or I had witnessed it with my father when he was passing away from cancer. You know, who are we to say, to deny what could be a potential helpful medicine for them? Now there's multiple Republican proposals that have built upon our original bill, the States Act, that I did with Earl Blumenauer back in 17. And we're continuing to progress in a way that gets people going, but you have to find them where their level of comfort exists or discomfort. And so despite the growing bipartisan consensus, there isn't much appetite for this bipartisan progress. You know, the failure of safe banking is one of those things. Everybody can agree that we shouldn't have a system out there where people are involved in a legal going concern in the state in which it's been blessed, not be able to access the banking system. And we're starting to see more and more criminal acts, unfortunately, upon those places, be it dispensaries or areas where the cash is being kept. and that's not safe for anyone. And the continuance of the MORE Act, which is we all know is DOA in the Senate, is we got to find more palatable paths forward. And so our idea was to consider, if you wouldn't mind the term, flooding the zone, things like piecemeal, like HOPE Act, the SAFE Act, the States Act, and putting those things out there in front of it instead of an all-inclusive one size fits all. Because as we know, we don't do big well. And so, but bit-sized pieces may be better. And if we can get the Senate to at least bite on some of these smaller ones, I think that we'll get into a position where, like my bill 3105, it's the first Republican bill to end federal prohibition, the first bill to call for federal regulation, and the only bipartisan bill to do so. So if we can get people to agree on some of those things on why we need to treat this like the alcohol industry and let professionals like my two partners here in this conversation, let them have the ability to do the research and deal with the science, and let the rest of us make sure that they have the wherewithal to get that done. I think that'll be a good step in the right direction. But even though Congress moves at a glacial pace, this is one thing that I've seen since my tongue lashing from Speaker Boehner. Now it get in the matter of 7 years, start to move in the right direction. And hopefully we can take it over the top soon.
Well, I hope today's conversation around what can be added from the federal side for help in mental health, both in research and protections, will be yet one more area where people can reach agreement that, of course, something needs to be done here. So I look forward to having you involved in this talk. On that, Dr. Gruber, we will be sending out the paper broadly today, but for those of us who might be auditory learners instead of readers, can you take a second to walk through what is in the paper and review the state of the research on cannabis and mental health?
Sure. Thanks again for inviting me to be part of such an important conversation. It might take more than a minute just to summarize the state of research, just to be clear, a little more than a minute. And I always like to remind people it's important to consider context, right? Cannabis has been around forever and use is continuing to increase both for medical and recreational purposes. And regardless of the legal status of cannabis, individuals are deciding to use products often without appropriate information and may then use it in ways that may not benefit them. It's particularly concerning for those with mental health conditions. We often hear claims from seemingly opposite ends of the spectrum. Either cannabis use causes psychosis, worsens psychiatric symptoms, and poses significant risk for developing cannabis use disorder, or on the other side, there's a dismissal of any claim of potential harm or side effects from cannabis use, instead focusing exclusively on potential therapeutic aspects. I think the truth is likely somewhere in the middle. We need to take a step back and look at how we can leverage the data we already have, while also considering what additional steps we need to take to craft sensible legislation that simultaneously provides protection and safety to vulnerable populations, for example, those with mental health conditions, but not limited to those folks, but also allows individuals the freedom to use appropriate products responsibly. We simply can't afford to wait for the perfect legislation or ideas to take form before we take action. Cannabis is like rock and roll. I always like to say it's here to stay. So we need to understand what we mean when we use the term cannabis, as it's often used to describe both the whole plant and anything that comes from it. And any of these individual compounds within the plant, which often confer a very wide range of different effects. Because of this, we can't simply use, as Representative Joyce said, a one-size-fits-all model. It doesn't work. We can't single-handedly either exclude or accept all products for all people for all conditions at all times. It just doesn't work. We have to recognize that cannabis is not one thing. There are over 100 cannabinoids in the plant. THC, or delta-9 tetrahydrocannabinol, is the primary intoxicating compound that everybody is pretty mindful of these days. And while it's been demonstrated to have medical benefits, it's also been associated with negative outcome. While CBD is a primary, but not the only, non-intoxicating compound in the plant, it's often touted for its medical benefit. While these two are the primary players and the most often studied, there are countless other compounds that likely contribute to the effects of specific products. So when you look at the state of the research, despite many claims, here's what we actually know with regard to mental health. It's on everybody's mind, sort of the question of cannabis and psychosis. We hear this a lot in psychiatry, and I can tell you that we have some data that suggests that cannabis may be one of many factors related to the manifestation of psychosis, and products with moderate or even low amounts of THC can exacerbate symptoms. On the other side, though, clinical trials of CBD products, or CBD-based products, have demonstrated therapeutic benefit in those with psychosis. When we think about anxiety, sort of the other big area, especially during the pandemic, there are mixed research findings reflecting a rather complex relationship, which is heavily influenced by the unique impact of the individual cannabinoids and the doses and ways in which cannabis is used. All of these things make a difference here. In general, though, higher doses of THC often produce or exacerbate anxiety, while lower doses of THC and mid-range doses of CBD can alleviate anxiety. When it comes to other conditions, things like, as we mentioned, Representative Joyce mentioned before, PTSD, bipolar disorder, major depression, cannabis use disorder, in general, study findings suggest they're sort of mixed or inconsistent, depending on what you're looking at. The population under study, the profile of the products being studied from the perspective of the cannabinoids inherent, the frequency of use, the amount and the ways in which these products are used, and a number of other variables. Each of those variables is important to consider in order to maximize benefit and minimize risk and harm. But exposure to products high in THC appears to be related to more negative outcomes in general, while the use of products high in CBD or perhaps other non-intoxicating cannabinoids appears to reduce the likelihood of negative outcome. We also, though, I have to say, have to consider things like age. We know, for example, that children, adolescents, emerging adults are all vulnerable, not just to cannabis, but to any substance, to alcohol, to illness, to injury, while the brain is still under construction, or if you're in cannabis research like me, while it's, it's half-baked. We have to consider things like family history and genetic liability. People with a personal history or family history, for example, of mental illness, particularly psychotic disorders, are at a much higher risk for adverse outcomes associated with cannabis use. Other medication use, this is a hugely important area and often overlooked one. Both THC and CBD can inhibit the metabolism of other drugs via interaction with the body's cytochrome P450 enzyme system. This is the enzyme system that allows us to effectively process drugs. And you could inadvertently, or one could inadvertently increase or decrease the amount of certain drugs in the system, which could result in adverse outcomes. We certainly need a lot more work in this area. And I probably would leave it there, since I've had definitely more than a minute to give you the overview.
Let me ask you to expand for just another minute, though. Where does those findings or that summary of findings lead us to for best practices on the federal level?
When I think of best practices, I get another minute, right? No, I'm just kidding. When I think of best practices for the government, I think of creating a framework to promote responsible use that has a two-pronged approach. Think of it as a two-pronged approach. First, we need prevention efforts to protect cannabis, for lack of a better term, cannabis consumers, be they, or whomever they are, that have a higher risk for negative outcomes. For example, children and adolescents, those with mental health conditions, or a family history of psychosis, individuals who may be pregnant. But we also, the second prong, we need to educate consumers and further encourage what I call responsible use. So we want to prevent overuse and encourage using, for example, things like lowest effective dose, right? So the lowest dose you might be able to get away with to get an effect. We also want to see standardization of things like packaging and dosing. We don't have a common lexicon here. Companies should be utilizing responsible marketing practices. We want very much, and we need to reduce barriers to cannabis research. We have to standardize tools for cannabis research. And very importantly, especially in our lab, we want to see investment in rigorous research focused on cannabinoid-based medications. Rigorous research, well-designed, empirically sound, controlled studies offer a rather unprecedented opportunity to customize and optimize cannabis and cannabinoid-based treatments, which hold great promise, but could ultimately change the narrative and transform patient care. I think that's all really important.
Thank you for that. And I think well worth the couple of extra minutes to give everybody a real basis in what will be the paper. I do urge everybody to read the paper. It is a page turner if you are interested in cannabis policy. It is issues that absolutely have to be handled not only at the federal, but also the state level when considering how best to proceed with cannabis regulation. Dr. Burnett, you have pointed out in the past that mental health cost of cannabis policy is a broader conversation than just the cannabis direct impact on the brain. Can you tell everybody what you mean by that, and how should Congress take that into account when creating cannabis policy?
Yeah, certainly. Again, I thank my two esteemed colleagues for their very intelligent comments and hard work on this effort. When we're thinking about cannabis policy, obviously, and in the context of mental health, it's not as simple as it may seem to just focus strictly on the potential or lack thereof of any sort of exacerbation of disease conditions. When we look at the status quo of the policy at the federal level, as Representative Joyce highlighted, prohibition and criminalization are in and of themselves problematic to individuals' mental health. There's a significant burden of disease within the criminal justice system and individuals under correctional control of mental health disorder. And when you're unfortunately incarcerated, your access to mental health care is exceedingly limited. And so when we're thinking about, what the federal government should do in terms of its strategy in addressing mental health more generally, ensuring that we're not placing individuals under correctional control for possession of certain substances, whether they be cannabis or any other substance, is something that should be top of mind from a legislative standpoint. And building out not only the framework for the safe regulation of cannabis products, but a public health framework focused around responsible use, as Dr. Gruber highlighted some of the facets of what that would look like, not only for individuals at risk or vulnerable to the negative aspects of potentially THC or other compounds within the cannabis plant, but to kind of help determine and inform the general public who doesn't have those same vulnerabilities about how best to utilize cannabis in all of its various forms safely and responsibly. So I think, as we're looking at legislative and public policy solutions, we've got to incorporate, strategies to remove people from criminal justice correctional control and enhance overall the public health aspects of this substance, and use effective regulation to do that. Because as you stated at the beginning of your talk, cannabis is here. It's the most widely used substance illicitly in the nation by far. And so what we're doing right now is pretending from a public policy standpoint that we cannot effectively regulate it at the federal level. And obviously, I believe that our members of Congress have much more capability than that.
Very well put. So this is for the group then, maybe directly pushing back on the last sentences from Dr. Burnett. So playing devil's advocate here, the paper states that there is some risk that cannabis use can have serious negative effects for its users. Why is that not a call for prohibition? Shouldn't we just declare it is illegal until we have more research here? Dr. Burnett, maybe start with you. I know it'd be reiterating some of the points from before, but this is a question for the group, and I would love to hear all of your thoughts.
So, Andrew, I lost you a little bit on the feedback. Can you just repeat the question?
Yep. Playing devil's advocate here, this paper states that there's some risk that cannabis use can have serious negative effects for its consumers. Right. Why is that not a call for prohibition? Shouldn't we just declare it is illegal until we have more research here?
Yeah, no, I think that is kicking the can down the road. The reality that there's lots of substances or, medications, for example, that we use inside of the clinical setting that have significant risks associated with them that, if used improperly, are very harmful. I mean, opioids in and of themselves are a perfect case in point that we're dealing with right now as a major public health issue. Those are a lot of people who end up with opiate use disorder start with prescription opioids, which physicians like myself write for pain management, right? Now, we haven't decided at that point in time to say, well, look, let's ban all opioids and keep opioids prohibited, because that wouldn't work. There's lots of positive benefits associated with, prescription medications for opioids to help treat pain. We clearly can see from lots of examples in history, whether they be alcohol as the most ready-made example, that prohibition as a matter of public policy is just lazy intellectual policy work, right? We have the ability to be able to structure and organize safe, rational regulation of substances in society. I mean, I could list hundreds of substances that are all under the purview of the Food and Drug Administration. They have the ability to be able to regulate them. And, you know, cannabis is a consumer good in multiple states at this point in time. A lot of people are underinformed. Let me say underinformed relative to the ability for them to have knowledge and understanding of what's in the products that they're able to purchase from dispensaries, from, you know, over the counter, and the context of CBD-based products and the passage of the Farm Bill that allowed for the establishment of that. All these sort of products that are on the shelves for consumers need effective information to be supplied or come on the packaging or in, you know, public pronouncements, so that people can be more informed and be able to make safer choices in how they're using the products that are available on the market. So the notion and idea that there's risk, and if there's risk, then we should do nothing but prohibit, is intellectually lazy, in my opinion.
Well, Representative Joyce, given that this is often something we're hearing from Congress people on it, that, you know, there's I think real fear of potential effects of cannabis on the brain. What do you say to those who say that's probably a call for continued prohibition of this?
Look, I'll leave the science to the actual doctors and researchers, but Congress and the federal government must stop standing in their way of their quest for these answers. And, you know, it's crazy to limit them to one type of cannabis that's grown at the University of Mississippi or wherever it was down there that the DEA would provide, when we know there's in each state the origin of the plants is like manna from heaven, right? These seeds just magically appear, and they grow certain things that they put names on. We need to know exactly what it is. So if you take a Tylenol in Ohio or California or Florida, that people know what it is they're ingesting. Congress does have an important role to play in providing that regulatory oversight, and everything ranging from product safety to labeling standards. And stepping up into this, the plate in this regard, will help differentiate between good products that provide relief versus snake oil. And the problems that, you know, as you drive around now, you see CBD in meals, CBD this, CBD that, you know, it prevents hair loss, you know, you name it, there's things out there. No, you know, let the researchers tell us what it's good for, what it's helpful for, and provide the framework like we do. And, you know, similar to the alcohol industry, again, if you buy a bottle of wine, you know it's a certain percentage. You buy a bottle of liquor, you know it's a certain percentage. You know what it is going into it. And you know that 80 proof is different than 120 proof. And those are the kind of standards we could apply after we have the science, and after we let the researchers do the work, and we have the science behind it to provide a framework nationwide for states to handle it the way they see fit.
Dr. Gruber, anything to add to this particular debate? And you're muted if you are. Yeah.
In terms of the prohibition question, I think it's been well covered, but I think it's really impossible to sort of move forward and just have a prohibition mindset when you know countless numbers of individuals continue to increase use over time, and prohibiting it clearly doesn't solve the problem. Let's just think back to, quote, prohibition. That didn't work out so well. So I think we'd better take a better informed approach and a more comprehensive approach, and remember that it's a fairly contentious issue. People have very strong feelings about cannabis. I've never met anybody that has lukewarm feelings about it. But you know, you can't really change the narrative unless you're willing to get in and have the conversations. So you have to actually, sort of to Dr. Burnett's point, you can't be lazy about it. You really have to go through and discuss the whats and the whys, and really understand what people are actually using in the real world for real conditions.
Andrea, if I could just add one other thing. I mean, just in terms of what it means for the rule of law, right? Like, if we're a nation of laws and we believe that, you know, everybody should be following them, and we have overt data that shows that the prohibition of cannabis is not preventing people from using cannabis, then obviously we need to think about how we're writing the structure of the policy so that it actually comports with what's happening in real life.
You're starting to sound like Supreme Court Justice Thomas there. Strange bedfellows in this world of cannabis.
First time.
Not to say maybe you and Justice Thomas go way back. So.
First time I've ever been compared. Interesting comparison, to say the least.
I do want to spend a moment. You've touched on it before, Dr. Gruber, but it's a main point that you've talked about a number of times. That cannabis is not one thing, and since I think that's new to this group and new to the group of listeners, I wonder if you can elucidate on that a little bit, and really how our understanding of cannabis has evolved over time. You know, we couldn't have called what this field of research needed to look like 20 years ago, but if you could go back and say, 20 years ago, we should have been asking these questions, and this is the way we should have been doing this. What do you wish we'd been studying in this area?
Yeah, I think it's a really great question, and to your point, I think there's a lot of misunderstanding and misperception. It isn't one thing, and most studies over the last several decades have looked at, quote, cannabis use with little information about what the cannabis is. Again, to Representative Joyce's point, we have to know these things because what's in it matters. You know, we call it the what's in your weed factor. It matters. We know that we have to understand more about individuals and what they're using and how they use these products, because believe it or not, the ways in which you use products actually makes a difference in terms of the effect that you get. That also impacts risk and benefit, believe it or not. In addition, as I mentioned, you know, things like age of onset, frequency of use, duration of use, product type, what we call cannabinoid exposure, how much of each thing are you being exposed to, or the profile of specific products, all important. We should have been studying real world products that patients use. We don't. We have zero ability to do that today. From the unfortunately, the federal perspective, we are not, as clinical researchers, able to do clinical trials on products that patients or consumers have access to. We can't use those in clinical trials. We are limited to what we can use. That's changing slightly, but it would be best to study real world products used by real world people in real world situations, not just in my lab, which is beautiful and lovely, but in the real world. We need controlled clinical trials of products that are analogous to those being used by consumers and therefore have what we would call external or ecological validity. Again, to Representative Joyce's point, the single party convention dictated that we have cannabis supplied for clinical trials for research from the National Institutes on Drug Abuse. And they've expanded their drug supply program exponentially, done great things, but they're not in the business of creating products that look anything like what you would see if you went into a dispensary. 99% of what they have is still flower, and it maxes out at a certain percentage with regard to THC. If we talk about potency, we don't have things that are similar to, for example, edibles or really what I would call turnkey sublingual tinctures, because I've had to make them myself. But these things are all really important to get a better handle. We have to also be able to integrate observational data, or we should have been able at this point to integrate observational data in a more empirically sound fashion. Real world data, again, from dispensaries could have been harnessed on a larger scale. We have a tendency to discount it because it's quote, just observational data or sometimes anecdotal data. Really important. And again, used correctly can be very powerful. So I think those are some of the things I wish we had been doing for the last 20 years. It's not too late. This is the time to do it.
We have one more question pre-written, but there is a Q&A portion. You can give questions either with your name attached or anonymously. We have time to get to them, so please use this time to put questions into the question and answer. For last question for the group from this side, this paper outlines a movement away from the prohibitionist federal government to one that advocates for a responsible use framework. Have we seen this framework adopted with other substances, and can we learn anything from the outcomes with those substances?
I'll jump in here and say, Representative Joyce made a great analogy with the alcohol regulatory framework. Now, what I will say is that there's definitely room for improvement to build on the lessons that we've learned from both alcohol and tobacco regulation from a public health standpoint that we could absolutely apply to the cannabis regulatory framework. But, as Dr. Gruber pointed out, responsible use can define set and setting, when it's appropriate to be using cannabis, when it's not appropriate to be using cannabis, factoring in personal risk factors, if you will. I mean, we're kind of moving into the age of personalized medicine, and there's lots and lots of products out in the marketplace where, you can get personal information to evaluate risk for yourself relative to, doing certain activities. But, we right now have a robust regulatory regime that regulates products, goods, and services through the Food and Drug Administration, right? The Food and Drug Administration is, if adequately funded, obviously, would be more than capable of applying the same scientific rigor to commercial products in the cannabis space as they do to commercial products in numerous other spaces in which people buy goods and services. So there's a litany of examples that you could list, but we've already got the fundamental structures in place to be able to do all of this inherent within the federal government.
Anything to add from either Representative Joyce?
Well, I do think the alcohol industry is something that they've done it. I've had discussions with the wine and spirit wholesalers, the alcohol industry folks. They've been able to work it, and it's also effective because, like here in Ohio, we have state-run liquor stores. The prices are set. You know what it is. Well, New York, California, Florida, they have market prices. So, the good part is if you like bourbon, we don't get much of it here in Ohio, but a bottle of Blanton is $52 if you can ever find one. You might find it in DC, it might be $100. But they've worked it out. There's a framework for doing that. And then the percentages are all graded, so if people want beer or the ever popular seltzers now, and in the flavors and the different quantities and contents, they're labeled in such a way that a person who takes one or two or has one or two of them and buys them, they know about where they should be at the end of it. Those same regulatory framework should be and needs to be in existence for cannabis industry as well. It's just going to require research.
Great. Moving to audience Q&A, unless Dr. Gruber, you have anything to add before we move to audience Q&A.
I was going to echo the sentiments of my two esteemed panelists and say it's not impossible to give people information about what products they're using and what they should expect, but you actually have to have the information on the package to be able to do that. So it's not undoable.
Question, Representative Joyce, do you think combining the expungement provisions of your HOPE Act or something like it with safe banking might be enough to assuage the concerns of Senate Majority Leader Schumer, Booker, and others who have said they are not willing to allow the banking legislation to advance ahead of justice and equity-focused cannabis reform?
Again, what I said in the beginning about trying to flood the zone, we're trying to give them options. And I think it's important that a big bill that we're pushing isn't necessarily the MORAG type of thing. Is too much. And you bring at least Republicans to the table because you want research. Well, we want more research. We want to make sure kids don't get it. We want to make sure kids don't get it. Whatever that sweet spot is, that helps bring them to the table, you can address more appropriately in smaller piece legislation than one size cures all. And the criminal justice aspects, I agree that people of color were probably over the years affected unfairly. But how do we address that? I think that can be addressed on its own. Some of the folks think, no, it needs to be coupled with this because otherwise it won't be brought up. Well, there's enough of us around, especially former prosecutors, who agree that we need to make changes and let's do it now. I mean, a long time ago, our fighting on the drug war was to create mandatory sentences because we didn't count on elected or appointed judges to do what they were elected or appointed to do. And so therefore, there's been a disparity in sentencing that needs to be addressed. Let's address it. And that's a problem. But, I think if we can talk about regulatory system, talk about the research system, talk about this either rescheduling or descheduling in bite-sized pieces, it'll be more appropriate for the Senate to be able to take that up because, one of the things obviously that bothers folks, the older they get, the more I hear about cartels and other issues. So I'm not saying the Senate's all old people, but I'm certainly saying that some have different viewpoints compared to the younger members of the House that are there at this time.
This question from Natalie Ferdig. Hey, I am curious what the medical professionals on this panel think of the fact that NIDA released data today showing that teen use of marijuana went down significantly during the pandemic. And question for all three, if there are any policy ways to encourage that number to stay lower as the nation reopens. Great question.
I think we talked a little bit about this before the meeting. I think that some of that's probably pandemic related in terms of the amount of ability for especially individuals in high school, which is where a lot of the monitoring of future data comes from, to be able to navigate and be out in the world during the midst of a pandemic. Now, just in response to the secondary question, if you look at the historical data, those that were claiming the sky would fall and that teens would get unmitigated access to cannabis once we, taxed and regulated cannabis in multiple states, have had to eat a lot of humble pie over the past couple of years insofar as that has not happened. And, really the fact of the matter is that effective regulation is much more capable of preventing inappropriate access to cannabis than drug dealers are. And so, if we want to continue to try to keep the number flat or push the number down, it means that we should move away from a framework of prohibition in which we are hoping for the best outcome and, hoping that kids don't actually manage to find the people who are selling cannabis on the black market.
Yeah, I would just add one quick thing, which is that the Monitoring the Future study is a tremendously helpful tool. It looks at data from 8th, 10th, and 12th graders across the nation with regard to all sorts of things, including, of course, cannabis use. And if we look at numbers, just before the pandemic, we didn't really see this huge kick up either. So it's very important to look at this because the numbers were going up for many, many years in a row, and then they began to stabilize and actually go down. I would remind people, if they don't know, it's a fun fact, older adults, which by definition in our federal government is anyone over the age of 50, that's right, 50 is now an older adult. The fastest growing group of consumers of cannabis in this country are older adults, 55 and older, 65 and older. Exponentially greater increases in the number of users per year than our 13 to 25-year-olds. So it's encouraging to see that from the perspective of being worried and concerned about our more vulnerable adolescents and teens, just as a fun fact.
And I would appreciate the research angle, but and just to give you a quick aside, in my time as prosecutor, my wife being a nurse would leave the house early and I'd be making breakfast for my kids. We're all in high school at the same time. And so there was an incident on a 420 day at the high school the day before. And I said, what took place at school today? And the older two just kept eating their food. And the youngest, the 9th grader, said, well, I know something happened. I said, well, is there marijuana at the school? And again, without batting an eye, the youngest one said, all you got to do is follow. And she gave the young person's name out to his car every day at 9:30. Yeah. So perhaps the school was where the interactions were taking place. But, and maybe that's what drove it down. But I do think we have to get that out there, that it's not good for young people while their brains are still forming. It's one thing for adults to make an intelligent decision, having the research in front of them on whether or not they want to be involved. But we certainly don't want to have kids to have it. And that's one thing I think we're all in agreement on. Unless, of course, it prevents seizures.
Very important distinction. Yeah.
Very important distinction. On that distinction, from the group, from the Q&A, do you worry that the growing popularity of cannabis as a medicine, some may overclaim what cannabis can do? Where do patients sit today in terms of access to credible information? What can the federal government do to separate the snake oil salespeople from those sharing quality research?
Those are 3 big questions, by the way. That's not one. Whoever sent that in, that's not one. You should be required to count those as 3. But I think all of us who are involved in cannabis-related research or cannabis-related work are very concerned about overstatements, and we see this every day. It's either we should put it in the drinking water because it's good for everything at all times for everyone, and there's no concern, or we should never go near it. So the overstatement can be problematic, especially when we look at products that are in the legal marketplace currently, because they don't necessarily reflect the what is stated on the label. Let's just say, again, the what's in your weed factor. I know because we pay for a lot of analyses of products in the marketplace. So we are concerned about that. And where do patients go or consumers go to get valid information? It's another great question. There should be a centralized, vetted system in place where people can get real information that's based in sort of on real data, as opposed to A bud tender may be suggesting it's great for this or great for that, or they had this experience. As helpful as that may be, it's not necessarily what most people need. And I'm not sure what was the third part of the question, Andrew? There was a third part.
Yep. What can the federal government do to separate the snake oil salesman from those sharing quality research? Which a little bit is a restatement of the second question.
Yeah, this is when I take the ball and I pass it to my esteemed panelist colleague, Representative Joyce, and say, it's up to you. I'm a scientist, you're the legislator.
Well, I think we discussed it before. We need the research from you all to get to the point where we can put the regulatory framework in place that allows people to identify their issue and what they need treatment for with what's available in the everyday market. And sort of the chicken egg theory, right? You can't do your research until we get the hell out of your way. So we're continuing to try to do that.
Schedule 1 status makes that a little bit dicey for some folks without a Schedule 1 license. I'll just say that.
And excuse me for 1 minute while I run to go get a charger because I'm down below 5%.
While Representative Joyce is getting his charger, the one thing I would say is, I think that the states are actively wrestling with this issue, right? Like they are, to the best of their ability, the states that have reformed cannabis laws, utilizing independent third-party laboratory testing to be able to try to get a handle on products that are being created and developed in the marketplace. Now, as Dr. Gruber mentioned earlier in the talk, there are significant challenges around standards relative to, measuring active ingredients in products, even for the definition of what is, a suitable serving size, right? Like there are real, sort of basic challenges in our frameworks and approaches to, getting accurate information out to the public. And so, the NIST people and individuals out there, National Institute of Standards and Technology, this is a ripe area for standardization to be able to get some baseline sort of measurements such that we can be able to do the requisite research necessary to be able to get the public informed on, what's happening. So, this is where all the, 4-letter entities within the federal government can step up and add their value for their particular niche in order to be able to, unpackage what this catch-all term of cannabis is really taking shape in society and how it's impacting people. So I think that's an important thing for the federal government to do in terms of being able to add value to what is already happening within the states.
Dr. Gruber, did you say research on CUD is mixed? And this is, can you explain that? And there's a little bit of personal information, but I'll share it because I think the context is helpful. As someone in recovery from CUD, I find that people question the existence of disorder harmful to recovery.
I always sound best on mute. I couldn't agree more. And actually, it is problematic when people question the diagnosis, and there's been a lot of discourse about it. And so actually, I think what I was saying, when I included CUD in the sort of list of things, including but not limited to bipolar disorder, PTSD, major depressive disorder, and CUD, we often have mixed data. So for example, although some individuals may develop cannabis use disorder as a result of using cannabis perhaps recreationally, let's just stick to recreationally because we have no data really on medical use. The majority of recreational cannabis consumers don't develop problematic patterns of use. So it's a little bit mixed in terms of what's reported. Interestingly, there's some very preliminary data suggesting that CBD may actually protect against the development of CUD. So I think it's incredibly important to, one, validate the existence and sort of acknowledge that there are individuals for whom cannabis use disorder is not only something that is a possibility, but a greater possibility given a number of factors. I would never discount it or downplay it. But I think we need a lot more work in this area. This is an incredibly important area. And I would also say one other thing. Very often, especially with the pandemic, we have an inability to assess individuals at an individual level. By that, I mean to do let's just say, a clinical diagnostic interview to ensure that somebody actually meets criteria for CUD and not just has, quote, likely problematic use. I hear this a lot. Likely problematic use. We actually looked at a sample of medical cannabis patients in our lab and found that they were nowhere near problematic use. But when people say likely problematic use, that's very different from problematic use. And you have to actually assess this specifically. Things like survey studies and indirect measurements make this more difficult to do. So sometimes the literature reflects a fairly mixed approach to assessing CUD in the real world. And I think it's a difficult area to have people understand thoroughly or comprehensively, because it's a complex problem. But it's certainly my statement of the fact that, research in general, in terms of a lot of these areas, is somewhat mixed, and we certainly need more. By no means did I mean to downplay or minimize it. It absolutely is a real thing and very, very important.
If I could add on to what Dr. Gruber said, the challenge is particularly difficult, and this is not just for cannabis use disorder, but as in the field of addiction medicine, we define use disorders as more than just dependence, more than just problematic use, but you actually have problems with your day-to-day life responsibilities. And so, it's a constellation of challenges beyond just the amount of cannabis that you're using, regardless of the frequency, right? Like if you use a lot of cannabis, but otherwise are able to meet all of your life obligations, you don't actually have a use disorder, right?
Exactly.
And so, it's important to be very precise with the definitions and, take into context all of the appropriate pieces of the puzzle according to the DSM diagnosis. Now, part of the challenge with that, and I'm going back to something that we talked about at the beginning of the discussion, is that in a large majority of, or in a large percentage of states, cannabis is criminalized. And so obviously, if you come to the emergency department with a problem and you're talking about this problem and it is about something that is illegal, then obviously you're going to have a challenge of underreporting, right? Because people will fear criminal prosecution for the use of a substance that is not legal. This is gigantic problem for mental health, right? And even if somebody is, has a non-stigmatized, or quote unquote, I mean, I think a lot of mental health is still stigmatized, but lesser stigmatized maybe is the appropriate term, mental health disorder in which they're using cannabis to self-medicate. We as physicians can't appropriately evaluate that because there's a criminal risk associated with using cannabis, right? So somebody may be using cannabis to self-medicate for their mental health disorder and be afraid to bring it to their physician in order to be able to discuss that impact on their overall mental health picture. So, it just goes to show the multitude of problems associated with continued criminalization of cannabis in discussing and dealing with the mental health issues that we're trying to address as a scientific research and physician community.
Can I just echo one quick point? Super, super important. If you take nothing else home from this today, take this home. Neither frequency nor magnitude of cannabis use define cannabis use disorder. Really important. People don't understand that. If you use every day, you must have cannabis use disorder. Absolutely not true. That's not true. And so I just wanted to expand on it because I spent a lot of time thinking about it. and it's a very, very important aspect of this that people don't really think about. It has to do with impairment in specific areas. You could use many, many times, many, many ways and not have cannabis use disorder. In fact, the majority of recreational consumers do not manifest CUD.
Indeed.
We have some awesome questions here that unfortunately we will not get to given the time, and I want to give everybody a second for closing thoughts. I will end with one of the questions is, where can we access this wonderful paper? And it will be, for those who've registered for this event, emailed directly to you. It will be posted on our social media, and you can expect to find it on our website starting later today or early tomorrow morning, and expect to see it pushed out quite frequently from us. So it will be all over the place, but easily findable on cpear.org. With that, closing thoughts from the group. If you did have, Dr. Gruber ended with one takeaway, but if you did have one takeaway that you wish for policymakers or the general public to understand when it comes to mental health and cannabis policy, what would you have that be?
The one thing I would say very quickly is that prohibition and continued criminalization of any substance undermines the ability to appropriately treat and deal with mental health disorders. And so, as we think about alternative strategies from a federal policy standpoint related to substances, cannabis being one of them, removing criminal penalties is priority number one in order to be able to get to effective mental health care.
Well, I appreciate being on today. I've learned a lot, and like I say, I'm not a doctor or researcher. I don't try to play one, but I certainly appreciate the updates that I've learned here today. It is my hope that both chambers can enact immediate reform. Given the narrow majority, this is going to require bipartisan support. But while we wait for further legislative action, the president should work to immediately downschedule cannabis to give doctors and scientists better access so you all can do the necessary research and treatments.
And Dr. Gruber, our esteemed author of today of the paper, any last closing thoughts?
I think I would just echo an earlier sentiment that was first articulated by Representative Joyce. In this case, in the case of cannabis, one size does not fit all. Just remember that. It's not one thing. You can't unilaterally approve or reject all products for all people, for all conditions. It just doesn't work that way. So we actually have to do the hard work, sort of suggested by Dr. Burnett. It's actually absolutely true. You can't be lazy. You actually have to dig in and take a more comprehensive approach.
Well, we're all about comprehensive approaches here at the Coalition for Cannabis Policy, Education, and Regulation. I can't thank you guys enough for your time, particularly given the last useful week before the holiday season, to jump on the phone and have this conversation. I found it extremely illuminating. I've gotten many comments to the same in the chat. I can't thank you again for the honor of your time, for your brilliance, your expertise, and your wisdom. Thank you again, and we look forward to continuing this conversation in 2022.
Absolutely. Thanks so much.
Thank you.
Thanks for having me. Thanks to my esteemed colleagues as well.
Thanks for having me. It's an honor.